Standard occlusion theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the 18th topic. Long-centric. 18. Long-centric. Contents. 1. Definitions. 2. Reasons for not setting long-centric in the molar region. 3. Formation of long-centric during habitual closed bite. Steps for long-centric formation. Step 1. Step 2. Step 3. 4. Cases where long-centric is automatically achieved through occlusal adjustment at centric relation. 5. Examination of occlusal contact points using bite paper. 6. Examples of examining occlusal contact points using bite paper. A. When the red mark aligns with the blue mark. B. When the red mark is positioned anterior to the blue mark. C. When the red mark is positioned posterior to the blue mark. 1. Definitions. Long-centric was introduced by Schuyler and is used as a term in opposition to the point-centric approach advocated by the Gnathology school. Dawson defined long-centric as the freedom to close the mandible either to centric relation or slightly anterior to centric relation in the anterior region, without altering the occlusal vertical dimension, as shown in the right illustration. 2. Reasons for not setting long-centric in the molar region. Long-centric is primarily set for the anterior teeth. As shown in illustration A on the right, even if the anterior guidance is horizontal, when the mandible moves anteriorly, the mandibular condyle moves anteriorly and inferiorly, as shown in illustration B on the right. As a result, the mandibular molars move downward along with the condyle. Therefore, even if anterior movement is level, posterior teeth, especially the molars, do not move level. For this reason, long-centric is not set on the posterior teeth. 3. Formation of long-centric during habitual closed bite. As shown in the illustration above right, patients who have undergone occlusal adjustment at centric relation and received appropriate anterior guidance may complain that closing their mouth is easy in the supine position, but it catches halfway when sitting. In such cases, it is determined that the patient's habitual occlusal contact during mouth closure is positioned anterior to centric relation. For these cases, even if centric relation is appropriate, the freedom of movement for the long-centric is required. In such cases, long-centric is established through the following 3 steps. Step 1. Elimination of occlusal interference in centric relation. Step 2. Confirmation of occlusal interference during habitual closed bite. Step 3. Elimination of occlusal interference during habitual closed bite. Step 1. Elimination of occlusal interference in centric relation. As shown in the illustration on the right, remove all occlusal interferences in the molar region until contact between the front teeth in the centric position can be confirmed, as usual. Step 2. Confirmation of occlusal interference during habitual closed bite. As shown in the illustration on the right, have the patient sit upright and perform tapping to confirm the occlusal interference of habitual closed mouth position. Step 3. Elimination of occlusal interference during habitual closed bite. As shown in the illustration on the right, If bite registration marks appear on the anterior slope area relative to the centric position, reduce the tooth so that the slopes do not contact during habitual closed bite. The required reduction should be 0.5 mm or less. 4. Cases where long centric is automatically achieved through occlusal adjustment at centric relation. When occlusal interference is eliminated through occlusal adjustment to reach centric relation, a long centric relation is automatically achieved. As shown in illustration A on the right, occlusal adjustment at centric relation eliminates all occlusal interferences from the occlusal contact position to centric relation. Consequently, as shown in illustration B on the right, a region of long centric is obtained across the entire path from the occlusal contact position to the acquired centric relation. Patients with adjusted occlusion can achieve free and stable occlusion at centric relation, the occlusal contact position, and their midpoints. 5. Examination of occlusal contact points using bite paper. Using blue bite paper, record occlusal contacts during habitual closed mouth position sitting. Next, guide the mandible to centric relation supine position and record occlusal contacts in centric relation using red bite paper. This allows comparison between habitual occlusal position blue and centric relation occlusal contacts red. Below, we explain various combinations using blue and red bite paper, their interpretations, and treatment methods. 6. Examples of examining occlusal contact points using bite paper. A. When the red mark aligns with the blue mark. As shown in the illustration on the right, when the blue and red marks align, it is determined that the habitual closed position and the centric position coincide. In this case, there is no need to assign a long centric. Not all patients require a long centric. In approximately 50% of patients, they can close their mouths directly to the centric position without occlusal interference while seated. B. When the red mark is positioned anterior to the blue mark. As shown in the illustration on the right, when the blue mark is positioned more anteriorly than the central red mark, a long centric occlusion must be formed. To achieve the required long centric occlusion, extend the centric stop of each tooth anteriorly by the same occlusal vertical dimension as the length of the blue mark. Care must be taken not to reduce the red mark area during this process. C. When the red mark is positioned posterior to the blue mark. As shown in the illustration on the right, if the blue impression is positioned posterior to the red impression, it indicates that the dentist was unable to accurately guide the mandible into centric relation. When recorded correctly, the red impression is positioned posterior to the blue impression. While the red and blue impressions may coincide, it is impossible for the blue impression to be posterior to the red impression. Standard occlusion theory for TMD. 18. Long centric is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 19. Bruxism.